Today we are going to deal on the most important endocrine gland. It is very essential for the metabolism, the growth and development and temperature regulation of our human beings. So that is what we call as thyroid gland. Now come to this, so what is thyroid gland, what is shape and what is size of the thyroid gland, and so what is the weight of the thyroid gland. Now come to what are the different hormones secreted by the thyroid gland and what are the functions of thyroid gland. So let us see one by one detail. Now come to the first one is location. Okay, so location. So the way the thyroid gland it is. The thyroid gland located in the just it is located in the neck just below the Adam's apple area. So that is larynx in front of trachea. Usually it is located just below the Adam's apple area. So that is larynx and above the trachea. It is the location of thyroid gland. Shape of thyroid gland. Now come to the shape of thyroid gland. So what is the usual shape of thyroid gland? Usual it appears as a butterfly in shape. Butterfly in shape. Okay, so see, it is a butterfly in shape. It appears as a butterfly shape because it is having a the tissue. It is a thin tissue. It connects the right lobe and left lobe. It gives a shape of the butterfly appearance. It means the usually the thyroid gland looks like the butterfly in the shape. Now come to the weight of thyroid gland. Here the weight usually the depends upon so that is situations. For example, you can take three P's: the pregnancy and the period and the menstrual cycle and the so that is puberty. The size varies. The usually the thyroid gland measures about so that 10 to 30 gram in weight. But in the during the pregnancy and the puberty as well as in the periods or menstrual cycles, its weight changes. In some books, they given as 25 to 30 or 15 to 30. The but it exactly is 10 to 30 gram in weight. Now come to the diameter or the size of a thyroid gland. Thyroid gland measures about the 4 to 6 centimeter in the length, height, and the 2 centimeter in wide and 1 centimeter in the thickness. But here, usually the isthmus, so that is the right lobe and the left lobe is connected by a specialized tissue, so that is to be called as, so that is isthmus. Isthmus is usually measures about 1.5 centimeter in the, so that is thickness. Now about the blood supply to the thyroid gland. Here, thyroid gland receives the blood supply from the so the thyroid arteries, thyroid superior and inferior thyroid arteries. Now come to the venous supply or venous drainage. The venous drainage, the waste eliminates through that is thyroid veins. Now come the nerve supply to the thyroid gland. Usually the nerve supply is supplied by the both sympathetic and the parasympathetic nervous system. Now come to the hormones. Different hormones secreted by the thyroid gland. Here, usually the thyroid hormone is secreted by the negative feedback mechanism. It means when there is a thyroid levels is increased in the blood, so there is no secretion of thyroid hormones take place. So this phenomena we call as negative feedback mechanism. So there is a slight difference between negative feedback mechanism and the positive feedback mechanism. But here thyroid glands so works on the negative feedback mechanism. It means so when there is a high amount of thyroid hormones there in the blood, so the pituitary gland the hypothalamus not produces any hormones. It inhibition takes place. So this is called as a negative feedback mechanism. Now come to the positive feedback mechanism means it means when there is a high level of so that is hormones there in the body and the hypothalamus and pituitary gland again secretes so that is hormones, it is called as a positive feedback mechanism. Oxytocin works on the so positive feedback mechanism. Here the thyroid hormones so that is secretion take place by the negative feedback mechanism. Here the three different hormones so they produced by the so the thyroid glands. The first one is T3. It is called as a triiodothyronine. T4, that is thyroxine, and one more is, so that is calcitonin. Calcitonin. Here the three different hormones produced by the thyroid gland, T3, T4 and calcitonin. So T3, T4 is very important during pregnancy and puberty. Here, during the pregnancy, the T3 and T4 hormones are very essential for the development of a brain of a fetus. For that reason, the almost all gynecologists most they are focusing on the T3 T4 levels, because if there is a normal means automatically the baby will be normal. If there is any variation means definitely the baby's the growth and development affect adversely. For that reason, almost all gynecologists more focuses on the T3 T4 levels. And also in the puberty, during the time of the puberty, it's very important. Suppose if during the pregnancy, during the puberty in the males, so the thyroid glands are not functioning properly. What happens? So there is no production of sperm as well as there is no production of sperm. So that is the testosterone. That's the effect upon the the puberty. Here the regulation is controlled by the, that is hypothalamus by the TRH and TSH. In a human body, so the thyroid hormone secreted by the under the influence of TRH and TSH. TRH means thyroid releasing hormone. It is secreted by the hypothalamus. It adversely affects upon the pituitary gland to secrete thyroid stimulating hormones. That TSH adversely affect upon the the thyroid gland to secrete T3 and T4 and calcitonin for secretion of thyroid hormones. So here, so the TRS from the hypothalamus is very important to stimulate the pituitary gland to secrete TSH, so the thyroid stimulating hormone. Thyroid stimulating hormones adversely affect upon the thyroid gland to secrete T3, T4 and calcitonin. Okay, now come to the what is the function of the calcitonin. The calcitonin is very important. It maintains or regulates the calcium level in the body. So this is very important to maintain the bone health and bone strength. Okay. So this is regarding the different hormones and the functions of the hormones. Now come to the what are disorders affect the thyroid gland. So hypothyroidism, first is hypothyroidism. Hypothyroidism, it means so there is a less secretion of thyroid hormones. The one more is hyperthyroidism. It means there is excessive amount of that is thyroid hormone secretion takes place. It will cause some disorders. Next, thyroiditis, Hashimoto's disease, and so some of the cancers affect the thyroid glands. Okay, so this is about the applied anatomy. So applied anatomy includes so hypothyroidism, hyperthyroidism, and thyroid. So there is cancers and thyroiditis. Okay, so this is regarding the what thyroid gland.